Hello, my name is Neil Alexander. Thank you so much for giving me the opportunity to talk to you today about what I believe will be a leap forward for Cerner's ability to innovate their electronic health record. I believe that we are in a great position to expand Cerner's platform into the growing demands of the virtual healthcare market that has expanded dramatically over the past months due to COVID-19. Through a detailed job-based segmentation process, we were able to identify outpatient healthcare clinics as the micro-segment of focus for our product. Initially, we considered a broader segment of the market, but we discovered that family healthcare providers have a set of unique and uniform needs that we will be able to satisfy through targeted products and services. As we look at virtual healthcare makeshift implementations available today for the primary healthcare providers, we realize an underlying circumstance of struggle presented in the lack of integration between the different connectivity systems currently used by primary care managers to conduct virtual healthcare. What does that really mean? Well, it means being able to connect and maintain a connection with patients at the other end of the virtual healthcare visit. I want you to imagine for just a moment being medically responsible for the care of 25 to 35 patients a day. If you average that out to 30 patients a day and cram it into a 9-hour workday, that amounts to 18 minutes per appointment, meaning you have to review the patient's record, do a medication reconciliation, consider all of their comorbidities of the patient, and then chart all of your findings in a legally binding document that is effective in communicating proper medical care. Do it all in 18 minutes. Now imagine that your connection isn't working properly, that it takes 3 minutes to get into the workplace environment, and that it's slow and choppy. Maybe only 14 to 15 minutes now. Maybe the audio cut out. 12, 13 minutes. You missed something, not sure you heard it, 10 minutes. Having a solid connection that allows you to proper communication is paramount to safe and proper care. The second struggle that we see has to do with charting delays over the provider having to retranscribe the notes from the virtual healthcare solution into the electronic healthcare system. This creates two fundamental problems. First, it extends working hours, which results in burnout and PCM churn. And second, an increase in risk of error, which by re-entering this data into the EHR creates liability for both the PCM and the practice. So with this in mind, we approached our innovation discovery process grounded in our vision. We set out to answer one simple question. How can we empower primary care providers to conduct an end-to-end virtual healthcare visit with the patient at the center of the healthcare experience as opposed to using external tools? We set out to design a solution that responds to the core value targets and unblock key struggles faced by our segment of opportunity. We chose to focus on the following 4 things. 1, enhancing the connection of the patient while simplifying the connection and scheduling process. 2, ensuring full interoperability between the virtual healthcare model and the broader electronic healthcare record solution. 3, improving the visibility of the PCM with one point of access to all patients and their clinical data. And 4, ensuring the highest security protocols are in place in support of the HIPAA-compliant virtual healthcare operations. Let's now consider the desired outcomes, or the set of value targets that customers are looking to achieve, are currently not being met by their existing solutions. We confirmed these pains through extensive interviews with healthcare providers. Here's the top 5 that we found. 1, appointment interruptions and delays. 2, charting backlogs, errors during the transcribing process, extended work days, and task duplication. We then confirm the desired gains that providers are essentially looking for when considering a virtual healthcare solution. At the top of the list were these: a streamlined communication, where a connection to the patient can be established seamlessly and successfully every time. A predictable workflow that puts the provider in charge of their schedule and allows them to prioritize the engagement with the patient during scheduled visits. To seamlessly chart the experience where making orders for a patient is simple. And finally, overhead reduction, essentially offloading the provider from multiple and duplicate administrative tasks so that they can focus on the patient experience, not all that paperwork. Now let me show you our value proposition in response to the validated customer priorities. The core of our value can be found in our modular integration of the virtual healthcare solution into the broader Cerner EHR system. Think of it as an app within the entire system, because that's exactly what it is, an app. And in our app, there's a single pane of glass that we have where everything related to healthcare experiences resides under one interface. The video-based virtual visit can be done within the same window or Cerner application as the chart review, medication reconciliation, and medical charting documentation. By opting for one familiar interface, healthcare practices are assured of smoothly and relatively quick adoption. The availability of what we call the Virtual Visit Connection Assistant removes the administrative pains from the practitioner by offering seamless connections to the patients. Finally, congruent charting integrity directly addresses the previous charting error risks identified through the customer's priority validation process. No longer do you have to chart after, but you can chart during your visit. Much like an actual visit, where you're where the patient's in with the provider. We chart while we talk to the patient, right? This will be the same thing. Patients talking to us, we can see them like they're in front of us, and we chart as we talk to them. Next, let's move on to our business model. Here we identify the core pillars of going to market. Key resources, core activities entailed by conducting the virtual healthcare visit, possible revenue streams and how they are related to costs, the key partnerships we will need to establish and successfully meet our value targets, the customer relationship pillars for after-sales support to ensure customer satisfaction. Among the key considerations I would like to highlight are that we are directly targeting our already large Cerner EHR install base, and this means we can accelerate both adoption and deployment. I'd also like to point out that the virtual healthcare app will be fully developed in-house in order to leverage Cerner product development and quality assurance teams. And then finally, when it comes to revenue model, our assumption is that we will follow the broader Cerner business model of a per user per month licensing. A detailed view of the business model is visually reflected here through our value exchange map. This highlights the direct relationship between Cerner and the target customer, as well as the partnership ecosystem that enables Cerner to bring a viable solution to market. It captures the exchange of value between one of the stakeholders, either through monetary compensation as a percentage of sales or through customer reach and other metrics that are indicated on the map. So next, what we did was ascertain an exhaustive set of value targets. We learned that many of these undershot value targets had congruent struggles. Those were their providers had to use multiple platforms to connect to patients and chart, that there was a limited to no integration between the platforms, that no automation occurred between the virtual platform and the patient chart. Many solutions had no HIPAA compliant security, and the data sharing process with patients and other entities was lacking. We then began to develop our demand creation strategy, where we focused on the outpatient primary care providers, since this is where most appointments occur in virtual healthcare. We then went into our market entry strategy. Here is where a lot of things are changing with the COVID environment. Currently, the Medicare program has increased geographic servicing flexibility, as well as loosened the requirements for online prescribing. This is expected to be permanent in future months and years. Hospital compensation for virtual care is about to become lucrative as opposed to just efficient due to these increases in Medicare reimbursement. While this sudden advancement in virtual healthcare adoption is exciting, it's also caused many non-integrated, inefficient, and security-compromised solutions to be put to use. That makes this an excellent time to enter this competitive market with our new solution. Our intention is to provide a virtual healthcare solution with superior value for PCMs, one that is fully integrated with their already established Cerner EHR. There are three main reasons that we believe we'll be able to add value that will not easily be duplicated. First, EHRs are expensive to make. They have high switching costs. Typically, they're written for at least a 10-year term, the contracts are. Second, our virtual care solution will be integrated with the Cerner EHR. There's much less of a chance for competitors or new market entrants duplicating our solution, since ours is a native first-party solution. And finally, development, support, they're extremely expensive to develop, and most of the EHRs do not become profitable until some level of adoption has occurred. So we use these value targets and demand creation strategies to design our prototype. Here you can see a version of our prototype where the PCM desktop interface shows the connection to the patient via the virtual care session, and you can review the patient information as well as chart on the current session. Once connected to the call, the PCM has one interface where they can talk to the patient and see the patient, as well as all the details of the patient. Currently, patients log in using different modes of communication, such as Skype, Teams, or Zoom, and they have difficulties connecting to the virtual care environment, impacting their overall experience. We pitched our prototype through a choice-based conjoint study and received positive feedback from our survey takers. In order to validate our opportunity, we conducted a CBC study, or choice-based conjoint study, with 5 attributes. The overall results of our first study showed that Cerner Virtual Health received a preference of 71%, slightly higher than the alternative. We assigned each of our 5 attributes 2 levels, that of our solution and that of the other solution in use. The Discover platform, which we used to create the CBC study, then allowed respondents to provide their feedback on what attribute level configuration they preferred. This slide shows the attributes that we included. They include in the survey along with the differential value that the Cerner Virtual Care solution provides for each. We then conducted a second study. In this study, we added the brand attribute in the third competing solution, the next best solution in use. The results of the survey showed that while Cerner still had the highest preference, the margins were between all 3 solutions was pretty slim. The study also revealed that the price was the most important attribute. Using the Discovery Simulator, we adjusted the price of Cerner down to $500, equal to that of the lowest priced bare bones alternative, and found that the preference for Cerner went up 40%, while Epic and iPatient dropped down 33% and 27% respectively. I believe this shows that if we have enough runway, we can significantly impact demand by adjusting the price point if need be. Here you can see the cost, price, and willingness to pay for Cerner versus Epic, which is the next best solution in use. This demonstrates that the cost component for both solutions are nearly identical, but the value generated, as shown by the willingness to pay, is materially different. The effect of this is that Cerner product has a longer runway, and that the ability to generate significantly more value to the customer is paramount. When correctly priced, as Cerner is at $850, customers will choose Cerner. This will enable Cerner to retain existing customers, again, 26% of the market share, and create significant pull to strip customers away from competing solutions. This is a quick review of our ecosystem blueprint. This allows us to analyze our supply chain customer connections to identify possible impacts to delivery of our service. We started with the customer, the healthcare provider organization, and worked backward from the customers into end users, and through our chain to our suppliers and then the internal teams. In doing this, we identified only a medium risk with the third-party video chat app providers. These risks were directly mitigated by appropriate product delivery to our customer patients, which includes an easy-to-use interface experience that reduces the entire connection to just 1 or 2 button presses without any further complexity. Our revenue model reflects that there's a huge current install base to target with almost 65,000 customers. We only need about 1.17 of that to meet our 26% profit target in our first year of launch. Our current market share, as I said before, is 26% of total family healthcare providers. We expect that Cerner's primary platform will continue to gain market share within that, and that the virtual healthcare option that we provide will be value added, enticing customers to switch from competing solutions. Even with our current customer base, if that stays stagnant, we expect to earn at least $112,000 in revenue per month for a total forecasted revenue of 1 year of $1.35 million. Here in the cost and profit assumptions from which our revenue model was based includes $1.2 million in total upfront costs. It's made up of a lot of things like product development, launch and awareness campaign, advertisement, etc. We expect these costs to be recovered over the first 5 years. Our operational costs of around $1 million includes an expected cost of goods sold at $750,000, which is made up of ongoing product development and management costs. Our general administrative costs are expected to be ongoing, roughly $200,000, and are comprised of sales and marketing expenditures, third-party licensing costs, and online service hosting fees. Profit assumptions are based on an initial target of 750 customers in the first year. This target is only slightly more than 1% of the addressable market. And at 1% of the addressable market, we're forecasting to generate $1.35 million in annual revenue, with $395,000 in operational profit, which produces an operating margin of 29%. In closing, we believe that our team has developed something pretty special here. A viable business model with a great job solution fit that brings our customers the best value to our business plan. And we believe that our business plan will effectively bring a solution to the market that is growing by leaps and bounds. Really, a sea change in the way that healthcare is being provided. But the technology hasn't caught up yet. The iron is hot. And we believe that this solution that we have offered here is the best solution going forward. Thank you for your time.